Okay, so going back to our discussion, we are now discussing the different types of culture media for the cultivation of Mycobacterium tuberculosis. Some of the popular culture media for Mycobacterium tuberculosis would include the LJ medium, also known as the Lowenstein-Jansen medium, consisting of eggs, salt, glycerol, potato, flour. So this one is considered as an agar-based, the egg-based medium. One of the most important components of the LJ medium is the presence of the malachite green. So malachite green would also inhibit the growth of other microorganisms. Then the Middlebrook medium, consisting of many factors, oleic acid, serum. This one is considered as the agar-based medium. Then the ATS, or the American Thoracic Society, it's basically the same as the LJ medium except that it doesn't contain any salt. So this is an appearance of the LJ medium. So it's green and there would be a bread-like or the breadcrumb-like growth here, indicating the growth of Mycobacterium tuberculosis. It's green primarily because of the fact that it contains malachite green. So this is the Middlebrook agar. We are also using the Middlebrook agar for the sensitivity testing. Okay, so aside from the Middlebrook agar, I told you a while ago that it's very important to take note that all culture media will have malachite green. This is the main inhibitory substances, and the main purpose of the malachite green is to suppress the growth of unwanted organisms such as gram-positive bacteria. Then we also have the liquid medium such as the Septicek. It is a paddle and liquid media. Okay, so paddle has the Middlebrook agar on one side, and then the LJ media and chocolate agar in separate region on the other side. So the reason why we include the chocolate agar is to detect the presence of Mycobacterium marinum and Mycobacterium haemophilum. Then another one is the isolator lysis centrifugation system. So this is an example of a Septicek agar. So it is a combination of both the agar and the liquid medium. Now, interestingly, this one is the chocolate agar. Then you can also have here a paddle that will have two agar at both sides. And then you have here the liquid medium. So this one is the isolator lysis centrifugation system. The reason why we call it the isolator lysis because the sputum sample is, or any sample is placed here, and then we centrifuge the specimen so that we'll be able to isolate the wanted organisms or the wanted specimen. Then that would be cultivated in another primary culture medium. Okay, so to know more about this, you may refer to table 26-2 of your book. So, what would be the cultural characteristics of Mycobacterium tuberculosis? As what I've told you a while ago, they are said to be slow grower. So, it will take you about 10 to 20 days at 37 degrees centigrade before you'll be able to see visible colonies. The colonies are expected to be small, dry, scaly, and would have a warty, or some book would call it cauliflower colonies. There are two descriptors for the colonies of the Mycobacterium. One is eugonic, the other one is dysgonic. Eugonic means that there is a luxuriant growth of Mycobacterium colonies, and this luxuriant growth is actually being enhanced by the presence of glycerol. Other Mycobacterium would have the so-called dysgonic growth, scanty, smooth growth, unlike to the rough and warty colonies seen in the eugonic growth. So this is an example of colonies characterized by a eugonic growth. So as you can see, It's rough, scaly, and would have a cauliflower-like colonies. The liquid medium is also being utilized for the cultivation of Mycobacterium tuberculosis. It is confirmed by the presence of a positive AFB smear. And then aside from that, it has to be re-inoculated in solid medium. So that would be our gold standards. So it will take us more than 6 weeks. Okay, more than 6 weeks for us to confirm the presence of a positive result. Except if you're using a septic check, the one I told you a while ago, it will take us 8 weeks for that. So these are the different kinds of the liquid media. The MJIT, the Bactec, septic check, continuous monitoring system, and the Middlebrook 7H9. By the way, the Middlebrook 7H10 and 7H11 are example of agar-based. Okay, it is not a liquid. They are not liquid media. So let's talk about the MJIT. MJIT stands for Mycobacterium Growth Indicator Tube. So this one, you have to incubate the specimen here, and then if the specimen flourishes, it's an indicator that it is indeed positive for Mycobacterium. Then you have to re-inoculate the sample into a solid medium. A semi-automated way of doing this one is by using a Bactec medium. Okay, Bactec medium would be of two types. Okay, so this one is for blood culture. Okay, for example, you are suspecting the presence of sepsis, then you have to place it in the Bactec medium. Now, the one with Panta means that there is a palmitic acid. So this one is specifically designed for Mycobacterium tuberculosis. At any rate, we place the specimen here, and then if you're going to cover the specimen, you have to designate a specific number wherein you place the vial. Let's say this one is vial number 2. Then if you cover it, and then the machine will detect the presence of turbidity. If there is a turbidity, this machine will alarm, and it will tell us what particular vial is positive. So this one is actually an automated way of telling, yes, you are positive in the screening or in the liquid medium. Again, if you are positive here in Bactec, then you have to re-inoculate the sample in solid medium. Usually, they are using the LJ medium for this. So this is the Middlebrook 7H9. So the presence of turbidity is again an indicator of a positive result. So this is an example, this tube is an example of a positive tube for Mycobacterium tuberculosis that will take about 4 weeks before we could see detectable turbidity. Rapid growers would take about 1 to 5 days, then there's already a turbidity in the medium. So, aside from the cultural methods, then we can also identify Mycobacterium using the acid-fast stain, like what I've mentioned before. And then, colony morphology. Okay, so we have already identified the difference between the dysgonic, and then the eugonic growth. So, fried egg appearance or cauliflower-like colonies are some of the adjectives that would describe Mycobacterium tuberculosis. And then, the colonies would also have the serpentine cord formation, virulence factor. Okay, I forgot to mention, but the sugar that is primarily responsible for the serpentine cord formation is the 5' trehalose. Okay, and then the Mycobacterium intracellulare would also have the fried egg appearance. So, growth rate. Mycobacterium tuberculosis is a slow grower. So, those that are rapid growers are usually non-pathogenic microorganisms. So, when we say it is a slow grower, it will take usually more than a week for you to have a visible colony. So, these are important pathogens, including the Mycobacterium tuberculosis, Mycobacterium bovis, and the Mycobacterium avium intracellulare complex. So the temperature would also help narrow the species. So remember, Mycobacterium tuberculosis would require 37 degrees centigrade because they are said to be mesophiles. Then, we can also identify Mycobacterium according to their photoreactivity. Okay, so they could be identified as photochromogens, scotochromogens, or non-chromogenic microorganisms or Mycobacterium. So, when we say photochromogens, which means that there is pigment in the presence of light. So, the pigment is the carotene pigment, and this is elaborated in the presence of light. Scotochromogens means that there is a pale yellow to orange color in the presence or absence of light. So which means that they do not require light in order for them to produce pigment. Now, when you say non-chromogens, it means that they do not produce any color at all, whether it is light or in the presence of light or in darkness. So this is a schematic diagram if you want to identify a specific species phenotypic characterization of a certain Mycobacterium species. So pigmentation is the primary criteria. Okay, so if you notice, there would also be different biochemical reactions which we will be discussing later on. So this will allow us to determine the different or the other species of Mycobacterium. Okay, now for the slow grower, for medically important microorganisms, we should be more concerned with slow grower. Why? Because majority of the pathogenic Mycobacterium would be here. Okay, so this would include the Fortricium, Chelonase, Phlegmatis, Flay, and Vaccae. But these organisms are also being differentiated according to their biochemical reactions. Okay, now one of the tests that we could probably do for Mycobacterium is to use the skin testing. So the skin testing is the tuberculin testing. Tuberculin testing is a type of hypersensitivity reaction. It is known as the type 4 hypersensitivity reaction. So what do we mean by type 4? Type 4 means that this type of hypersensitivity reaction is delayed hypersensitivity reaction. So this type is a delayed type of hypersensitivity reaction. So when you say delayed, it will take about 24 to 48 hours before you'll be able to see a visible reaction. So the principle of delayed hypersensitivity reaction involves cell-mediated immunity, which means that there's no immunoglobulin involved in this particular type of hypersensitivity reaction. The older way of doing this is by means of utilizing the old tuberculin. It is usually a filtrate of glycerol broth culture, and it has been allowed to be concentrated by evaporation on a water bath. But nowadays, you're not anymore using the old tuberculin, and the tuberculin testing is now commercially available in the form of PPD, also known as the purified protein derivative. So it is prepared from culture filtrates of bacilli grown on synthetic medium, and it has been purified by precipitation with TCA. So there are different ways of doing the tuberculin testing. Okay, so you can use a tuberculin syringe and inject it into the skin of the patient. So this is known as the MAN2 test. Or we could rub the PPD into the skin. So we call it the von Perkay. Or we could probably use a gauze or a tape, then allow it, and then we apply it on the skin. So by means of a patching, so that's why it's called the Volmer patch test. Then sometimes we could you could actually place the PPD together with an ointment, and then we rub it into the skin of the patient. So we call it the moro-percutaneous test or time test. Time test utilizes a multi-prong inoculation, which I will show you later on. So this is the MAT2 test. So this is a tuberculin syringe. It is being intracutaneously injected into the skin of the patient, and then we measure the erythema or the reddening of the skin. The erythema should be more than 10 millimeter in order to be considered as a positive result. Less than 5 millimeter means that it is a negative result, thus the patient has not yet been exposed to tuberculosis. Because once you get a positive result, it means that you had previous infection, or you had been exposed to tuberculosis, or you just underwent BCG immunization. 5 to 10 millimeter is indeterminate, so you cannot make conclusion out of this result. Okay, so again, MAN2 test or tuberculin testing employs type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction is the delayed type hypersensitivity reaction, which involves cell-mediated immunity. So, unlike humoral immunity, when you say cell-mediated immunity, there would be no immunoglobulin involved here. So, this is a von per K test. Okay, so the von per K test. Okay, so the same positive result. Then the Volmer patch test, a gauze or a tape is being placed. Then you see the result for 24 to 48 hours after. Then the time test. Time test here is a multi-prong inoculation, which means that there are several sharp ends here, and it will be inoculated into the patient. So the same result as the MAN2 test. Okay, so we now go to the biochemical identification of Mycobacterium, different species of Mycobacterium. So remember, biochemical identification is for the phenotypic characterization. So what are the different ways of doing this? Niacin accumulation, it is based on the principle that Mycobacterium can convert niacin to another compound known as the ribonucleotide. Okay, so Mycobacterium tuberculosis converts this to nicotinic acid. So cyanogen, bromide, and aniline will eventually produce a yellow color, which is considered as a positive result. So, here is an example of a positive result of the niacin test. So, the substance responsible for this, again, do not forget the cyanogen bromide in the presence of amine or the aniline compound. So, Mycobacterium tuberculosis is unable to convert niacin to niacin ribonucleotide. Okay, so that's the reason why Mycobacterium tuberculosis is considered as a positive result. Okay, is a positive organism for the niacin test, and the yellow compound is considered as a positive result. Okay, another biochemical test is the nitrate test. The nitrate test involves another enzyme, and this one is called the nitroreductase, which reduces nitrate to nitrite. Okay, so this enzyme is responsible for this reduction, and it is positive for Mycobacterium kansasi and Mycobacterium tuberculosis. So this nitroreductase enzyme is detected in the presence of sulfanilamide and naphthyl-ethylene diamine reagents. So we have a tongue twister here. So a positive result here is the presence of the red diazonium dye. So here you go. The intensity of the nitrate reduction test, the positivity or the grading of the nitrate reduction test depends on the intensity of the color being produced after the addition of the reagents. So as you can see, +5 here would have an intense, dark intense, deep red result, while a A control would be negative, so it remains colorless. +1 means there's a pale pink. +3, it means it's darker than the +1, but less dark than the +5. Catalase test. I think you are familiar with this already. The enzyme that would be capable of hydrolyzing hydrogen peroxide into water and oxygen. But there's a twist here for Mycobacterium because we add the twin 80, the detergent. So after 5 minutes, you'll be able to see bubbles or rapid effervescence of gas as a positive result. So we usually measure the height, okay, of the bubbles being produced to make it semi-quantitative after the addition of the twin 80. Okay, so we measure the column, so it has to be more than 45 millimeter to be considered as a positive result. This is a different catalase test when you're doing the Staphylococcus aureus because there you just add hydrogen peroxide into the colonies, but here we still add the twin 80 detergent. Then the bubble would be greater or would be higher. So this would be measured. So more than 45 millimeter is considered as a positive result. Okay, a control won't have any rapid effervescence of gas at all. Aryl sulfatase test usually is important for the fortuitium chelone complex. So it utilizes the enzyme known as the aryl sulfatase, which could hydrolyze the bond between the sulfate and the aromatic ring structure. So it is because of the fact that this complex of organisms could secrete the enzyme aryl sulfatase. Then aryl sulfatase will now split the free phenolphthalein from the tripotassium salt of phenolphthalein disulfate. So the phenolphthalein salt is incorporated into oleic acid agar. So this is the name of the medium for the test, the oleic acid agar. And the test is performed by adding small amount of alkaline solution, usually in the form of sodium carbonate, into the surface of the 3-day-old culture. So you have to culture the organism, the suspected organism for 3 days. Then you add sodium carbonate. Then if there is a positive purple color, then that is considered as a positive reaction. The twin 80 hydrolysis. So twin 80 would usually concern the following species: Kansasi, Gordonei, Marinum, Flavescens, Gastri, Terrae, Triviale, Malmoense. Okay, because these species would have one denominator and they are capable of having this enzyme known as lipase. Does it ring a bell? Lipase is a hydrolytic enzyme that could hydrolyze lipids. Okay, lipids. What would be the source of lipid? And that is your detergent, the twin 80. So this one, twin 80, or the polyoxetylene sorbitan monooleate. Okay, so once this lipase enzyme from this organism splits twin 80, the product would be oleic acid and polyoxytylated sorbitol. So modifies the optical characteristic of the solution from straw yellow to pink. So this one means it is uninoculated yet, so it's straw yellow. Then eventually, if it's positive, then it will become pink. Another one is the iron uptake test. So this concerns another group of, or another species of Mycobacterium, the Mycobacterium fortuitium or fortuitum. So these organisms would have the capability of uptaking an inorganic iron-containing reagent, usually in the form of ferric ammonia citrate, and eventually develops rusty brown colonies after prolonged incubation. But you have to have a citrate reagent added in the solution for you to see the rusty brown colonies. So this is considered as the positive result in the iron uptake test. The presence of rusty brown colonies means that it has already been converted to ferric ammonium citrate to iron oxide. A negative result would be like this. So, and this is the control. Then, the other one is the pyrazinamidase test. The pyrazinamidase test, the enzyme pyrazinamidase could hydrolyze pyrazinamide to pyrazinol acid and ammonia. Okay, so as you can see, the brownish ring on top of the bot is considered as a positive reaction. Okay, then the tellurite reduction test. This one reduced potassium tellurite to tellurium. So, black color is considered as a positive result. So, let me go back. So, here, the presence of black color. So, you have to invert the tube, but not in such a way that it will spill out. Okay, or you have to look at the bottom of the tube. Okay, or better yet, you should have a test tube rack with mirror below the tube so that you'll be able to visualize the results. Then the urease test. The enzyme urease could hydrolyze urea. And as a result, ammonia would be released, and it is characterized by a deep pink or a deep red color. Then there would also be inhibitory tests. So this group of tests is known as the inhibitory test because upon addition of this reagent, some organisms would be inhibited, which means that they will not be able to grow. So that's the reason why we call it the inhibitory test. So this includes the NAP, which inhibits the M tuberculosis complex, then the TCH, which would allow you to differentiate Mycobacterium bovis from Mycobacterium tuberculosis. So usually Mycobacterium bovis would have zone of inhibition, which means that they are susceptible to TCH, whereas Mycobacterium tuberculosis would be resistant. Then, sodium chloride tolerance test, because sodium chloride would inhibit most Mycobacterium except for the flavescens and trivialis species. And then, the growth on McConkey agar. Interestingly, Mycobacterium fortuitum chelonate complex are some of the few groups that could grow on McConkey agar. However, the McConkey agar should be divided with crystal violet. Okay, so the TCH, or the thiophene carbolic acid hydroside, I did mention this a while ago. It inhibits the growth of M. bovis. But my other Mycobacterium can grow in the presence of the TCH. You can also do HPLC. HPLC is used for the isolation of a particular compound, such as the mycolic acid. Mycolic acid is a common denominator for all species of Mycobacterium. But you need to extract it, and it's kind of difficult for you to extract mycolic acid. Hybridization and the NAAT test. So, it's a commercial probe. So, this one is not anymore for phenotypic characterization, but for genotypic characterization. And this is not being done routinely, usually for research purposes. Susceptibility testing. Take note of the first bullet. It says it's difficult. Primarily because the organisms would require complex medium, so you cannot use the ordinary Muller-Hinton agar for this one. And another thing is that they are slow grower. So you have to have a thick agar. Usually you place them in a ziplock so that it won't dehydrate easily. So you have to have a training for you to have, or for you to perform the susceptibility testing. So these are some of the drugs that we are using for susceptibility testing and the corresponding concentration. So for more information, visit table 26-3 of your Mahon book. Then immunodiagnosis could be done by means of skin testing, which I've already mentioned a while ago, the Mantoux test, etc. And then by means of serological tests wherein we detect antibodies associated with Mycobacterium. Okay, so these are the most important complexes of Mycobacterium. Among these complex, Of course, the one that is involved in tuberculosis is the tubercle bacillus complex, made up of three important species: Mycobacterium tuberculosis, Mycobacterium africanum, and Mycobacterium bovis. Other complex would include the MAI, the Avium intracellularis scrofulaceum complex, and the atypical mycobacteria, sometimes known as pseudotubercle bacilli, unclassified mycobacteria, anonymous mycobacteria, or the MOTT, mycobacterium other than tuberculous mycobacteria. Runions actually classified this atypical mycobacteria into four groups, which I think I did mention a while ago. The photochromogens, because photochromogens in the presence of carotene and in the presence of light would allow carotene to be elaborated, so there would be yellow pigment. Scotochromogens means that they could produce pigment either in dark or in light. However, some would have a more intensified pigment in the presence of light. Non-chromogens means that they don't produce any pigment, whether in dark or in light. And then rapid growers are those that can grow within 7 days. So these are the summary of the different classification of mycobacterium according to photoreactivity. And this would be the different classifications. So take note, slow growers are usually pathogenic. And number one in our list for the slow grower would be Mycobacterium tuberculosis. This also includes another pathogenic species, the bovis, okay, the ulcerans. So all of these are mostly pathogenic. Then we have the photochromogens, then the scotochromogens, and then the rapid growers. Okay, so let us now discuss another important species of Mycobacterium, the Mycobacterium leprae, also known as the Hansen's bacillus. One of the characteristics of the presence of Mycobacterium leprae in a tissue is the presence of lepra cells. So this is an example of a lepra cells. Acid-fast bacilli is found inside the epithelial cells and monocytes. So these organisms would have cigar packet or picket fence arrangement. You cannot cultivate it. You cannot cultivate Mycobacterium leprae even in LJ, American Thoracic Society, Petragnani. You have to catch an armadillo and try to inoculate it in its footpad. So how difficult could that be? They could oxidize DOPA, and they have this predilection toward peripheral nerves, which means that you could be numb, you could be insensitive once you are infected with Mycobacterium leprae. Someone could splash, let's say, a boiling water into your skin and you won't feel anything at all. Mycobacterium leprae would have glycine in the cell wall. So it would have a different mycolic acid, aside from, not like the mycolic acid of the Mycobacterium tuberculosis. So the GC content of DNA is 55.8% lower than other AFB. GC refers to the nucleic acid, to the nucleotide base in the DNA. Okay. And then the specific antigen is the phenolic glycolipid. And the pyridine could lose acid fastness, and the mycolic acid is classified as C20. So this is the base of G. Armalier Hansen, okay, the one who discovered the Mycobacterium tuberculosis. So he was the one who discovered. So that's the reason why its common name is Hansen's bacillus. Okay, this is the armadillo, the one that you have to catch in the laboratory if you want to have Mycobacterium tuberculosis cultivated. And this is the lepra cells, Hansen's bacillus, that would have the characteristic of picket fence arrangement. There are two forms of leprosy, and being a slow grower, the incubation period would be about 2 to 4 years. Okay, so I will give you time to read the two forms of leprosy and tell me which one would you rather have. Would it be the tuberculoid type or the lepromatous type? Well, if you want to choose a lesser evil, then that would be the tuberculoid type, otherwise known as the anesthetic type, because there would be only few acid-fast bacilli here and low infectivity. So here you'll have few erythromatous or hypopigmentation plaques with flat centers, raised demarcated borders. So this one is positive for the lepromin test. On the other hand, the nodular type would have an extensive tissue destruction with disfiguring lesion. So that's the reason why if you have lepromatous form of leprosy, then you have to place patches into the lesion. You have to wear rubber shoes. You have to apply bandage, because there's a chance that the skin, or let's say if the ear is infected, then there's a chance that it could be detached from the body. So you do not want that to happen while you are walking. That, oh, that's my ear or that's my nose. So you do not want that to happen. So you need to apply bandage. There is also a diffuse nerve involvement with patchy sensory lesion. This one is negative for the lepromin test. By the way, lepromin test is the skin test for leprosy. For tuberculosis, we call it the tuberculin test. So again, this is the tuberculoid form of leprosy. And then this is the lepromatous form of leprosy. So tuberculoid is the lesser evil. So another one, lepromatous leprosy. So lepromatous leprosy involves cell-mediated immunity as well. Okay, tuberculoid leprosy involves cell-mediated immunity, but the one that would have the instructive adaptive cellular response, it would be the T helper cell one. So lepromin test is the skin test for leprosy, wherein we use the sterile extract from lepromatous lesion. There will be two types of reaction in the lepromin test: the early or the Fernandez reaction. In the reaction will be about 24 to 48 hours. The late or the Mitsuda reaction would occur 3 to 4 weeks after the inoculation of the lepromin. So remember, only the tuberculoid form of leprosy would be positive for lepromin test. Treatment and prevention: multiple drug therapy such as dapsone, or the combination of dapsone and rifampin. BCG may somehow prevent it, but it's not totally effective at all, I should say. Okay, so that ends the discussion on Mycobacterium tuberculosis and other important species of Mycobacterium. I hope that you would learn from this screencast. I know that it's different whenever you see me live, but it is the other alternative that we could possibly have, since we are in holiday for almost a week. Could you imagine that? And of course, I know that for the fact that aside from the black lady, you're also missing me. So that would be all. By the way, for additional lecture for Mycobacterium leprae, I have actually uploaded the link in your e-learning. So that would be all, and good luck everyone to your final exams.